All right, y'all. We back with another reaction on taking care of Maya. Trial day 23. I'm playing catch up. Got a little business. Busy. Jack, on behalf of his children, Maya and Kyle, and the estate of his late wife, Beta, filed the lawsuit against John Hawkins, All Children Medical Hospital, which treated his daughter beginning in 2015. Okay, Kowalski said the hospital treatment and accusation of child abuse against Beta led her to take her own life in January 2017. Opening statement in the case began on September 21st. Prosecutors accused that hospital of medical malpractice, battery, and Maya false imprisonment, intentional infliction of emotional stress, and alleged fraud. The attorney representing the hospital said in his opening statement that actions taken by John was reasonable and in the best interest of the patient. While the lawsuit was initially filed against multiple people, an Eighth Amendment complaint filed on January 24, 23, listed owner of the hospital and Catherine Batty, a social worker, as defendants. A filing on Monday after jury selection had already started, removed Betty as a defendant. Wow. According to the lawsuit, Maya was initially admitted to JHACT in July 2015 for a severe asthma attack and began experiencing severe pain, significant weakness. Okay. What I'm going to do is I'm going to go ahead on, since it's kind of a little late for me, I'm going to get started with this trial. Y'all enjoy and put in your comment, okay? Thank you.
Do you mind if I sit?
That's fine.
Okay. So we would like to an Instagram photo taken on February 9th, 2016, and post number 14401.
Objection, relevance. I think we faced number of cumulative objections for trying to reduce.
Well, if I need, it was 3 days before she is in Dr. Barr's office saying that she has pain that is like fire throughout her entire body. Secondly, it shows that her ears are pierced, which goes to several people testifying that piercings would be cause pain with RSD, and it shows no lesions on the skin. And I don't think we've put in many photographs at all yet.
It does nothing to establish if she
Objection, that is absolutely not the purpose. They are going to attempt to make the jury believe, I don't know what about in that pose, but we assert 403 on that. Property value is far more than just a young girl.
Judge, this isn't like surveillance. This is a photograph she took of herself and posted on Instagram. It's the day after she was in a doctor's office telling them she has pain throughout her entire body like fire.
The court will receive the evidence 3227-0135.
Thank you. 3227-0485. This is taken on April 23rd, 2016. Shows her wearing a metal bracelet around her wrist and her hand and no lesions.
Don't we all, cumulative, Your Honor, don't we already have not only testimony, but other photographs?
I'll let this one in, but Ms. Groves, we're getting to the point where,
That's fine, Judge.
I mean, we almost have a family photo album of probably about
Well,
40 or 50 pictures by now.
Well, I did try to pick different dates, Judge. I do have one more along those lines. So that I'd like the court to look at.
Sure.
That is 3227-0441. The significant 616, when she's in a wheelchair, you can see that she is sitting on the edge of a table of some sort, raising her left leg. Time frame.
Objection, this is again cumulative to about 7 or 8 other photos and indicates what? That she can sit in more than a wheelchair? What is it probative of, other than just some kind of prejudice
This is
about the,
when she's in, isn't this when she goes to the hospital? This is during Dr. Hana's treatment.
Sitting
She's
there.
in a wheelchair, supposedly. She can't move her legs. This is a photo taken on July 16th, 16. She's sitting with her own body without any support on a hard surface.
her playing around in the pool and demonstrating her upper body strength based
This
on
is-
the ketamine infusions, based on where she was with her therapies.
I'm going to let in 3227-0441.
Thank you, Judge.
And cumulative. by the way.
Listed this one. Number 3089. I think we just. Are you able to play that?
Cumulative to other ones and does not demonstrate anything other than what is already in the records. Yes, she can play the piano.
Well, the other piano one was not during the admission of the hospital. I don't remember the date, but I know it wasn't during the hospital because it was at home.
Yes.
I'm going to admit, what number is this?
3089.
3089, the court receives.
32320819.
3233. Okay, let's go ahead and put it up, whatever it is.
It's a blog by Bianca Kowalski, dated 8/10/2015. We were gonna redact the comments above and below, Judge. I thought that had been done, but, so it would start at user Beata Kowalski, and then the text, and then the date at the bottom.
Didn't I just let in yesterday a whole series of emails from Beata Kowalski over any number of dates?
Those were I thought about all about Tacoma. This is
Well,
August
no,
10th.
I mean, there were lots of them because they went not only during the November of 2015, but they went all the way almost
Okay, well, I'll
in
withdraw this.
2016.
Let me take a step back from that, Judge, and look at what was admitted before we go to this.
Because, I mean, there's a cumulative issue.
Yeah.
I let in a whole bunch of them.
Sorry, let me see if I can find that, Judge. Okay.
Well, if you're gonna cry, I'm not gonna.
I think
Judge,
he's talking to Mr. Whitney.
I'm sorry?
He is.
Yes, we're
We're
talking
having a
about,
moment, sorry.
very mad at me, I didn't ask the questions he wanted.
Okay.
Never mind.
It's just, if you all want to talk to each other, you really need to push the silence button. And
I understand.
I mean, we all hear
The-
when you know,
Including the jury.
yeah, including like doing this with your fingernails, like I just did, and all sorts of other. Moving the microphone like that doesn't really do it. You need to hit the mute button. And
Okay, let's see what this this dude had to say, y'all.
but she was actively participating in that transfer. I can't recall exactly, but doing that transfer, she was actively participating in that to do so.
does it not seem reasonable Maya would be moving and sitting better during the piano January 3rd, 2017, and she would have had numerous physical therapy sessions?
Yes, exactly. I think that's exactly the point, is that we've been working with her that entire time, working on
Thank
sitting
you.
activities. So it's entirely reasonable that her sitting is better, because that's a lot of what we worked on. We're working on core strength, core stability, sitting balance, dynamic sitting balance. So I think it's entirely reasonable that by January, that
Did you think that her being Maya's lack of participation was due to her?
I'm not a psychologist, so I don't know that I can comment on depression or anything of that sort. I think that's outside of my scope of practice. So,
Is distraction a typical tool to use in PT with children?
sometimes we have we see kids of all ages, and when we're in the hospital, they're focused on a lot other than what we want or need them to do. So for Maya, we use distraction to get her focus off of the pain and onto an activity to improve her strength and function. For another patient, say like a 3-year-old who has cancer, we might use play as a distraction. Instead of, we're not going to engage in conversation with a 3-year-old, but we're going to present toys that they enjoy or an activity that they enjoy at home in order to distract them from all of the lines and tubes and everything else going around them in the hospital, to focus on the task to improve their function or whatever their goals are.
Before caring for Maya, had you had any formal training provided by Johns Hopkins on CRPS?
Yes, I had. So when I was a student, I had a clinical internship at Johns Hopkins, all children's in their outpatient sports clinic. And during that time, we had seen several CRPS patients. So at that time, I was under the clinical supervision of a licensed therapist. And we had frequent discussions about what proper treatment is for patients with that condition. Also, when Hopkins, when you're a new employee, you have clinical mentors so you can throw ideas off of, treatment ideas, things like that. As was brought up, there was another PT who was also treating Maya at the same time. So we would frequently go back and forth with treatment ideas or techniques or things that we could try during various sessions. So there was a significant support in training, I feel, prior to seeing Maya.
Before caring for Maya, how many CRPS patients had you cared for?
So prior to seeing Maya, I finished that 4-year degree in physical therapy school where we talk about chronic pain. We talk about CRPS and proper treatment. I had seen 2 or 3 maybe during my clinical internship, maybe 4. And then while I was licensed before Maya, between my outpatient experience and inpatient experience, it was probably around 5.
Is it more common to have a spasm with passive movement on a limb that has not been moved in a long time?
Can you repeat that one more time? Sorry.
Is it more common to have a spasm with passive movement on a limb that has not been moved in a long time?
I don't know that it's more common. Spasms can be caused by different reasons. So passive range of motion is, like I said, the patient doing no active movement, right? They're not squeezing their muscle. They're not activating any of their muscle fibers. It's simply the therapist lifting their leg, working on range of motion, usually of a joint. So like I said before, if you're weak in that leg or that muscle's not used to extending and flexing with what we're doing, it can cause a spasm. But also, with active range of motion, those can cause spasms too. And there are other reasons that spasms cause with no motion. My work with Maya, from what I recall and from the documentation, that's the only spasm I noted. And the 20 hours I spent with her, 21 sessions, that was the only time I documented on a spasm. And I don't recall any other active or passive spasms during my time with her.
Other physical therapists that worked with Maya indicated in testimony that CRPS patients find cross-leg position, crisscross applesauce, the most comfortable for that condition. Is that not your knowledge with regard to that leg position?
So my experience with CRPS over the last 9 years is that it's highly variable. CRPS can affect any limb of the body, any joint of the body. So, and that allodynia, that hypersensitivity to touch, can be in various areas. So it's really highly dependent on where the patient is having their pain, what it feels like for them, and then what their comfort positions are. So I don't know that I could say in general that crisscross is a overall general comfort position for patients with CRPS. If I have a patient with a CRPS of their elbow, they're not going to have a problem getting into crisscross. But if I have another patient who has CRPS of their knee or in their knee, crisscross may be very difficult, or it might be that comfort position. It's highly variable how these patients present. So I wouldn't say, I can say in general that that's a comfort position in general for CRPS patients.
I see in your note from December 1st, 2016, and then also documented in January, that you documented, quote, transfers to and from the couch with max assist, end quote. Can you please define max assist to the jury?
Sure. So in therapy, we use different terms to describe how much assist a patient needs. And it's a scale. So max assist would mean the therapist is providing 75%, and the patient is providing 25% of the effort, or of the effort to complete that task. So 75% total assist would be 100% for the therapist. Mod assist, as I said earlier, is 50-50. Min assist would be 75% for the patient and 25% for the therapist. And then we use words like contact guard assist, which just like holding their hand or holding their back for support, or standby assist, which is being close and monitoring, but seeing them do it by themselves.
Did you have any interactions with Kathy Beatty regarding Maya's care?
I remember working with Kathy Beatty. I don't remember having any conversations specifically with her about Maya.
So you wouldn't know how often those interactions were?
No idea.
Did you attend interdisciplinary rounds on Maya?
I remember having many communications with various providers about Maya and her case and how she's presenting, and kind of giving my input. I don't recall attending any specific interdisciplinary rounds where everyone got together.
So if you don't recall, then you want to know who was present.
Correct.
Were you aware if upper or senior management was aware of Maya being in your hospital?
I have no reference to know whether they did or didn't.
We have heard testimony Maya was a fall risk. Is it a policy at the hospital to use a gait belt when transferring children with a fall risk at the hospital?
It is. There are various thoughts on gait belts, whether they're helpful or not. I believe after this video, we did have gait belt on her frequently. I think during the video you saw, I didn't have a gait belt because that was one of my first times seeing her, and I was assessing what she was able to do. Still providing the proper assistance to make sure she didn't fall. She was safe, monitored. But afterwards, I do believe we had a gait belt on her when we brought her down to the therapy gym and things like that.
The exhibit 1002-0188 that read conversion disorder as a treatment diagnosis had an admitted date of January 6, 2017. Do you know if this diagnosis was listed on the previous admitted date, October 7, 2016, when you first started therapy?
I don't know off the top of my head. The way those medical diagnoses are viewed from a physical therapy perspective is that doctors make those medical diagnoses, and they end up in our chart based on what the physicians consult us for. We're a consulting service, so in order for us to come see a patient, the physician has to consult us to come and work with them. My treatment diagnoses under that are the physical therapy treatment diagnoses, the things that we're trying to improve. I think that answers the question.
Next question. Back in 2015, when you were employed by Johns Hopkins All Children's Hospital, you were very book smart, but you were new to the position. Now, 8 years later, I believe you testified what therapies you use for CRPS today are the same that was used in treatment for Maya back then. In 8 years since Maya, you are saying there has been no improvements in the therapies used for CRPS patients? And that's a question.
So the conservative physical therapy treatments that we use for all CRPS patients are research-based They're contained, and research is shown within what's called the clinical practice guideline, which is held by the APTA, which is the American Physical Therapy Association, which is the national organization over physical therapy. So they have it's called a clinical practice guideline. So it has the collection of the research that shows that physical therapy treatment, various physical therapy treatments are effective and beneficial for the treatment of complex regional pain syndrome. Every so often, no new research comes out. To my knowledge, the graded exercise that I've talked about all day today, that, based on how the patient is doing, pushing them within their limits to do as much as they can, grading them up to do more, grading down if it's a day where they're having more pain or more complaints. That is the standard for physical therapy treatment. We have options within there like therapeutic exercise, working on ADLs, things like neuromuscular rehab, which is kind of making the connection between the nervous system and the body in order to improve the function. But at the end of the day, the big goal of physical therapy, what you're trained to do in school and in your internships and in your training on the job, is to find those impairments, find those difficulties, the range of motion, the strength, the walking, and then develop a treatment plan to improve those things. And that's exactly what we did with Maya. Our treatment plan, the treatment plan I wanted to perform with her didn't go exactly as we wanted, right? As I said before, she wasn't walking when she left, but we did things every single session that was inside that clinical practice guideline in order to help her improve in her function.
Dr. Cecil, you stated at first Maya was 5 or 6 times a week for therapy. Is that correct?
Yes.
As time went on, it was lessened because Maya refused or couldn't do it. Refresh my memory. Was it refused or could not?
It was a combination of both. She, at the beginning, if you're reading through the notes, the first several times I saw her, we were attempting to stand. We were, supported standing with assistance in order to start building strength in our legs and to tolerate standing more. The goal of those sessions is to work through the pain in order to become more functional. Oftentimes what we see in chronic pain patients, CRPS and other chronic pain, is that function improves before pain improves. And that was our goal, is to improve her function. That's the physical therapy goal, to improve her function. So as we kept going, her function was improving in some ways, but in the areas that we wanted to see improvement, the standing, walking, participating in those things, she was flat out refusing, which we were never going to push her past and into something that she was refusing to do. We were never going to make her do something that she said she couldn't do. When she was agreeable, when she would take in any education and participate in things that we know would be beneficial, then we would do those things together. But at the point where we decreased her from that 6 times a week to 3 times a week, we had gotten to the point where it had been several sessions where we had plateaued and not made any progress. We had reached those goals that she left with. So that's why we decreased her, with that knowledge of if she can start doing more, if during those 3 times a week that we're still seeing her, she can start doing more, she can show us that, hey, look, I can move my legs a little bit, I can tolerate it, I want to try, I'm not going to refuse, then we would have immediately moved her back up to a higher frequency and seen her more often.
Could this, quote, could not, would not, end quote, been a result in Maya's CRPS affecting her physical or mental abilities and therefore her performance?
Do you mind repeating that one more time?
Could this, could not, would not been a result in Maya's CRPS affecting her physical or mental abilities and therefore her performance?
Certainly, her medical condition affects how she's going to participate, how she's feeling, how she interprets her pain affects how she participates in therapy 100%. Her mental capacity, that's outside my scope. I'm not going to comment on that. But our job as a physical therapist, as I mentioned, is we're going to grade what activity we do. Like I said, grade up, grade down based on how she's feeling and her feedback on certain activities. So if she, I think there was a good example in there of sitting in her wheelchair. She was doing well. We were doing things. And I wanted her to transition to a chair that had no arms. I had seen her sitting in her wheelchair without using the arms. So I was like, oh, let's transition, maybe a stand pivot, maybe a scoot into this chair that has no arms, and then continue doing what we're doing. But she would say she couldn't do it. She refused. I would try to educate her on why that's important and how, hey, it's the same. It's just another chair without arms that you're not using anyways. But I didn't make her do it. If she refused and said she couldn't, or she was fearful of falling, even with me there guarding her and protecting her, we didn't go there. We didn't do that.
Mr. Hughes, any follow-up?
No, thank you.
Mr. Anderson?
Testified that the only time you had noted the muscle spasms. Can we look at 1914? Top of the page. You see right there in the top?
Can you go to the previous page so we can see the whole sentence?
Page 5. I think he wants to see the page prior. Is that you?
Yes, sir.
Let's look at 1947. Second from the bottom, well, third line from the bottom, 1947. It's actually second line, yeah, from the bottom. Yep. Across there, there you go. Okay, let's see. Is that you?
Yes, sir.
3 times that you noted muscle spasms in her legs. Is that right?
Yes, it is.
And when you started out, she was receiving some pain meds, but then you stopped those as time went on, right?
I don't have anything to do with must or medications. I don't prescribe. I don't give them out. It has nothing to do with medication.
Mr. Hughes, anything?
No.
Members of the jury, any follow-up? Okay, made its witness be excused?
Yes, Your Honor.
Yes.
Or release from subpoenas?
Yes, sir.
Thanks, sir. Okay, members of the jury, we have, I understand, a deposition that is.
Can we approach?
Sure.
Well, y'all, we're going to stop. I want to say something. Hold on for a minute. I want to say something. People, if she taking therapy, therapy is supposed to help you get better. When you go to therapy, it's a mental, physical, and emotional thought when you go there. Some days you're going to feel like you want to participate, and some days you're not. So, excuse me. Maya might not have been having a good day. She probably didn't want to do therapy that day. I had to go to therapy for my knees. It were days I might not want to be bothered with a therapist. I mean, to do therapy. So that's what therapy for, is to get well, to get better. Because she walking now. But they trying to straighten everything out because they thinking that she pretending. You can't say that. But y'all tell me what y'all think. I'm staying on this case. I'm staying on them. I'm out, y'all.